Sleep is very important after surgery. Optimal sleep helps with surgical recovery, speeds the healing process, and makes a child to be better equipped to deal with the stress of surgery and recovery. Sleep disturbance can occur in patients after surgery, especially after a long and complex surgery. If the child is in the hospital, just the virtue of being on a different bed, a different room, a new environment can contribute to difficulty sleeping. This disturbed sleep can lead to higher post surgery pain, changes in behavior, and negative emotions like whining, crying, and worrying. Changes in behavior may show as anxiety, bedwetting, nightmares, and waking up crying. Even though these things can happen, fortunately, the magnitude of these are minimal in most children. There are many factors that are associated with the development of sleep disturbances. It is important to know what affects post surgery sleep so these can be taken care of appropriately. Some of the factors affecting post surgery sleep in children are chronic health conditions that exist prior to surgery, severity of surgical trauma, pain, nausea or vomiting, environmental factors, type of anesthesia, and whatever the situation that may be which leads to discomfort. Children with pre existing anxiety tend to have both more pain perception and sleep disturbance. Anesthesia may contribute to disturbed post surgery sleep patterns by affecting sleep wake cycle. Parents of young children have reported sleep disturbances with both the gaseous form and the intravenous form of anesthesia. The use of regional anesthesia or a nerve block is associated with better pain control and better sleep and is offered as an option whenever it is safe and feasible to do so. The sleep disturbance with anesthesia is yet to be quantified using objective tests in a lab. The good news is that there are many things that can help improve sleep and get over from surgery a little sooner. Sometimes the simplest things can be very relaxing and it is easy to forget them. If allowed to have a shower, a warm water bath can be a natural therapy to ease out some pain, freshen up, and help with some good sleep. The room temperature should not be too warm or too cold as this makes the child uncomfortable and can impair sleep. If there is an option, the room temperature should be set to optimal levels. If there are no restrictions based on surgery and health condition, having a good carbohydrate meal and hydration can help to doze off the child for a good sleep. Children who can listen to music can benefit from a relaxing music. It is good to allow the child stay active to the extent they can during the day, as this has benefits beyond improving comfort and sleep. On the same note, it is important to minimize night activities and have a quiet, dim room to help restore the normal sleep-wake cycle. If the child stays in the hospital after surgery or is in the intensive care unit, restricting night activities can be difficult. Although not easy in children, an eye mask and a earplug can help older children if it is safe to do so. These relaxation techniques often helps in combination with sleep hygiene to reduce anxiety, have a calm child, and minimize waking up in the night. Sleep hygiene is a set of positive behaviors that are beneficial for the development of healthy sleep habits. Some examples of sleep hygiene behaviors include maintaining consistent bed and wake times, a quiet and dim room to sleep, avoiding caffeine, and outdoor activities during daytime. Any side effects can interfere with sleep. This is particularly important for pain and vomiting. Some degree of pain is inherent with any surgery, especially during the early or later part of the night. The pain medication should be dosed according to the doctor's instructions so pain is taken care of appropriately since pain can impair sleep. Watch our video on nausea after anesthesia and how to take care of it by clicking the link above. In children, diaphragmatic breathing has been found to be beneficial to reduce anxiety and pain, both of which can promote sleep. Check out the description below for links to videos on how to do diaphragmatic breathing in children. This method is also used for symptom management of children with asthma, and diaphragmatic breathing can be particularly beneficial in asthmatic children who have surgery. Talk to your doctor about post-surgery care and to learn all the things on how to keep the child comfortable and safe after surgery. I hope you found value with this video. Make sure you smash the subscribe button and the bell icon next to it to receive updates when a new video is released. Like, share, and follow us for videos related to anesthesia and surgery like this one and other videos related to child health and wellness. Thank you and have a great day.